Well, hello, everyone. Thank you so much for taking time to join our Cobenfy New to Therapy and Drug Insights series today. My name is Dana Gress. I'm the VP of Clinical Services for Genoa Healthcare, and I'm excited to bring this educational series to life with Shannon Thompson. Shannon serves as the Program Design and Implementation Specialist at Genoa Healthcare. As a pharmacist, she collaborates with various teams across the enterprise to create and structure programs that optimize medication therapy management, patient care, and pharmacy operations to ensure the successful implementation of new business initiatives. Her role involves not only designing and launching these programs, but also tracking key performance indicators throughout their duration to ensure that they meet our strategic goals. By leveraging her expertise in pharmacy and program management, she helps drive innovation and efficiency within our organization. As part of this role, she also serves as the semi-dedicated program specialist supporting Genoa Clinical Services Cobenfy New to Therapy program. And without further ado, I'm going to pass it over to Shannon.
All right. Thank you, Dana, for the introduction. Hello, everyone. Again, my name is Shannon Thompson, and I welcome you to today's presentation. Today, we will review new to therapy and drug insights for the Cobenfy product. Here's what we'll cover today. First, we'll start with a Cobenfy overview, where I'll walk through the mechanism of action, dosing considerations, safety profile, and what the clinical evidence tells us about its role in treating schizophrenia. This will help to set the foundation for understanding why this medication is generating interest and how it compares with existing therapies. Next, we'll transition into Genoa Clinical Services and our New to Therapy program. I'll explain how the program works, how we identify and engage new starts, and the impact that we're seeing in terms of adherence, safety monitoring, and overall clinical outcomes. This section really highlights the value that Genoa brings when supporting patients initiating a medication like Cobenfy. After that, we'll discuss some of the operational challenges and opportunities that we're seeing in the field. This includes things like prior authorization hurdles, varying payer requirements, and coordination needs between pharmacies, prescribers, and care teams. I'll also share some ways that we can streamline these processes to reduce delays and improve continuity of care. And finally, we'll wrap up with closing remarks, summarizing key takeaways and outlining opportunities for partnership and next steps moving forward. With that, let's get started. First up is an overview on Cobenfy. Let's begin with a review of the mechanism of action and the indication for the prescription medication. Cobenfy is indicated for the treatment of schizophrenia in adults. It is a combination capsule containing xanomeline and trospium chloride. Xanomeline is a muscarinic agonist that crosses the blood-brain barrier. Its role is to modulate cholinergic signaling, which is really the therapeutic driver behind this medication. Trospium chloride, on the other hand, is a muscarinic antagonist, and it does not cross the blood-brain barrier. This medication is included specifically to help offset the peripheral adverse effects caused by xanomeline. This combination gives Cobenfy a truly unique mechanism of action compared to other antipsychotics. Most antipsychotics work by blocking dopamine and serotonin receptors to reduce those positive symptoms seen in schizophrenia. But even with current treatments, we still see significant limitations. Many patients struggle with adverse effects or incomplete therapeutic response. In fact, somewhere between 20 to 50% of patients don't respond adequately to existing antipsychotic medications, which really highlights the need for alternative mechanisms and better tolerated options. Cobenfy is dosed orally twice daily on an empty stomach. In clinical trials, it was noted that Cobenfy's bodily absorption was decreased when taken with food, meaning that the drug was not as effective. Additionally, since trospium was not being absorbed as well, this led to more reports of GI side effects. This medication comes as a capsule formulation and requires titration to reach the maintenance dose, which helps minimize gastrointestinal side effects during initiation. The titration schedule is typically designed to gradually increase the dose to the target level for optimal efficacy and tolerability. It's recommended to start at the 50 milligram xanolamine with 20 milligram trospium dose for 2 days, then increase to the 100 milligram xanomeline 20 milligram trospium for 5 days, and then reaching maintenance dose of 125 milligrams of xanomeline with 30 milligrams of trospium. It's important to titrate all patients to the recommended maintenance dose of Cobenfy because the trospium chloride component is intentionally higher at that dose in order to offset those peripheral adverse effects from the xanomeline. Reaching the maintenance dose ensures optimal tolerability and therapeutic benefit. Zofran was used in clinical trials to help mitigate those GI side effects, so some prescribers may choose to prescribe this agent as needed while patients are going through that period of GI discomfort. Of note, there are specific considerations in dosing Cobenfy for geriatric patients. Additionally, it's recommended to assess liver enzymes, bilirubin, and heart rate before starting Cobenfy and as clinically indicated. Now let's review the key safety considerations for Cobenfy, starting with the contraindications. Cobenfy should not be used in patients with urinary retention, hepatic impairment, gastric retention, or untreated narrow-angle glaucoma. These conditions are important to screen for upfront because each of them increases the risk of significant complications related to the medication's anticholinergic activity. Next, we'll also look at the common adverse effects reported with Cobenfy. As you can see, most of the side effects listed at the top are gastrointestinal in nature. Things like nausea, dyspepsia, constipation, vomiting, abdominal pain, and diarrhea. Other commonly observed effects include hypertension, tachycardia, dizziness, and GERD. These adverse effects largely reflect the muscarinic activity of the medication, particularly the peripheral effects that can occur despite the paired mechanism of xanomeline and trospium. When starting patients on Cobenfy, it's important to set expectations, monitor closely for these effects, and provide guidance on managing GI symptoms, especially early on in treatment. As seen on the previous slide, the most common adverse effects to address with Cobenfy are nausea and vomiting. GI symptoms are the most frequent cause of early discontinuation. Proper titration and patient education can significantly reduce these issues. This graph shows the percentage of patients with first occurrence of nausea or vomiting when initiating Cobenfy treatment. We can see that nausea and vomiting peaked at 1 week on medication, typically when the patients are titrated to the 100 milligram of xanomeline with 20 milligrams of trospium dose. Once the maintenance dose was initiated, the reported rates of nausea and vomiting decreased significantly. This goes to show that titrating to the maintenance dose helps to minimize those GI side effects and ensures adequate trospium chloride to offset those cholinergic effects occurring in the periphery. Next, we can review the clinical evidence and efficacy information for Cobenfy. There are a few key insights that resulted from the EMERGENT-4 trial, which evaluated the long-term safety, tolerability, and efficacy of Cobenfy that I'd like to highlight. First, nearly 70% of those studied achieved a 30% or greater PANSS reduction. PANSS stands for Positive and Negative Syndrome Scale, and this is a standard tool that prescribers use to assess symptom severity. So what this means is nearly 7 out of 10 patients experienced a clinically meaningful improvement in their schizophrenia symptoms. Additionally, those studied experienced less weight gain versus risperidone and olanzapine, which are 2 antipsychotic medications currently used to treat schizophrenia. Cobenfy demonstrated a more favorable metabolic profile compared to the commonly used antipsychotics, reducing the risk of weight-related complications that often impact adherence and long-term health. Cobenfy demonstrated comparable efficacy to aripiprazole, which is another antipsychotic medication used to treat schizophrenia, as well as risperidone and olanzapine. Despite its novel mechanism, Cobenfy does provide similar symptom control to established antipsychotics, making it a viable alternative for patients who struggle with side effects or have an incomplete response to those traditional dopamine-based therapies. It's also worthwhile to note, following the recommended dosing instructions is important for symptom control. As we reviewed, GI side effects are the most common early in therapy, so titrating those patients to the full maintenance dose ensures the adequate trospium chloride to counter those peripheral cholinergic effects, improving tolerability. Shown here is a Kaplan-Meier persistence graph. This is a type of statistical plot that shows the proportion of patients who continue taking a medication over a defined period of time. The higher and flatter the curve, the better the persistence. As we see here at month 1, 98.2% of patients remained on Cobenfy. This indicates excellent initial tolerability and engagement. The curve shows a modest drop after the first month and then stabilizes, which suggests that most discontinuations occur early on in treatment. Persistence above 80% at the 5-month mark is very strong compared to typical antipsychotic adherence rates, which often fall below 60% by the 6-month mark. This supports the value of early titration and adherence interventions to maintain those patients through those critical first 2 months of treatment. Again, it's important to reinforce maintenance dose titration and GI symptom management during the first month to prevent early discontinuations. This slide shows a comparison of other medication use before and after Cobenfy was initiated. The pre-initiation period, shown in gray, is defined as 2.6 months leading up to Cobenfy initiation, and the post-initiation period in blue is defined as the time during which patients were on Cobenfy treatment. We can see here that the usage of oral antidepressants, mood stabilizers, anticholinergics, anticonvulsants, opioids, and psychostimulants were reduced after initiation with Cobenfy. Further analysis is needed. However, these preliminary results could show that Cobenfy use may lead to a decrease in usage or dose of other medication classes. This slide highlights a measure used in clinical research that shows how many patients need to be treated with a specific therapy for one additional person to benefit. This is referred to as the number needed to treat, or NNT. It tells you how effective a treatment is by answering the question of how many patients must receive this treatment for one patient to experience the desired outcome. For example, if the number needed to treat is 5, that means that for every 5 patients treated, one person benefits who would not have benefited on placebo or standard treatment. Lower number needed to treat numbers, so values less than 10, indicate a strong likelihood of clinical benefit. As a result of the emergent trials, the Cobenfy number needed to treat is somewhere between 4 and 6. As a comparison, antipsychotics used in acute schizophrenia treatment, number needed to treat values are commonly clustered between 5 and 10. Aripiprazole has a number needed to treat of 5, and olanzapine and risperidone both have a number needed to treat of 8. So this shows a very promising number needed to treat for the Cobenfy product. Similarly, studies are also conducted to determine the number needed to harm for medications. Number needed to harm, or NNH, tells us how many patients need to be treated before one person experiences a harmful side effect from the medication. We want this number to be high, meaning that many people who need to be treated in order for the drug to be considered harmful. These number needed to harm values help clinicians weigh the risks versus benefit when selecting an antipsychotic therapy. A low number needed to harm, such as values less than 10, indicates high risk of a specific side effect. For example, the number needed to harm for olanzapine is low with weight gain, meaning that more folks are likely to experience this side effect with that medication. Higher numbers needed to harm, such as values greater than 50, suggests rare harm. So, for example, ziprazidone's number needed to harm for QT prolongation and quetiapine's number needed to harm for akathisia are very high, meaning that less individuals are likely to experience these more serious side effects. As we see here on the graph for Cobenfy, the lowest number needed to harm for Cobenfy are, as we would expect, which are GI side effects, including nausea, vomiting, constipation, and dyspepsia. All others are listed above 20, indicating that a higher number needed to harm is needed in order to experience more serious side effects. For comparison, we can see here that 68 is the number needed to harm for Cobenfy for akathisia. For comparison, this number is between 25 and 40 for aripiprazole and olanzapine, and 10 to 15 for risperidone and Vraylar. Also of note, there's no difference in weight gain for Cobenfy at all, as shown in gray on the chart here, whereas the number needed to harm for weight gain for olanzapine is between 4 and 7 patients. Next, we will review our new to therapy program operated by Genoa Clinical Services. We launched our new to therapy program in October of 2024 to align with the release of Cobenfy into the market. Our program identifies members that use Genoa Pharmacy and are new to treatment with Cobenfy. As part of our outreach, we wait 3 days after shipment of the medication to ensure that the member has medication on hand and has likely started taking the product by the time we connect with them. We review many aspects of drug therapy, including a dosage review to ensure appropriateness, screening for any barriers to adherence. We provide product education, screen and report any adverse events, and communicate any drug therapy problems to providers. We also provide follow-up calls to review the same events as in the initial call and to confirm continued use of medication. As a result of our new to therapy program, we aim to see improved proportion of days covered, or PDC, a reduction in gap days, an increase in days on therapy, and optimized medication therapy through medication action plans to help members stay on treatment. For our Cobenfy new to therapy program, we provide structured calls at appropriate cadences to ensure that we're checking in with members at critical points in their therapy. During the first month of therapy, we provide weekly outreach calls, as this time period is crucial for ensuring proper medication usage and side effect mitigation. During the second month of therapy, we provide 2 calls, ideally around week 6 and week 8 of treatment. And then beginning in the third month of therapy, we outreach members quarterly through the first year on medication. The goal of this cadence is to improve persistence on therapy and to obtain better patient outcomes. In addition to our outreach calls, we also provide healthcare provider notifications for when we are unable to engage with a member. This is designed to notify prescribers that additional monitoring may be needed for members that we were not able to engage with. We also communicate with providers when drug therapy problems arise. Examples of these would be improper dosing, either being taken incorrectly or at inappropriate doses, drug interactions, adverse drug reactions, non-adherence, and cost concerns. Connecting directly with prescribers helps to provide timely resolution of any therapy issues, incorporate shared decision-making, and ultimately improve patient persistence and safety. Shown here are some of our clinical engagement metrics for the new to therapy program. We were happily surprised by the volume of patients that were prescribed Cobenfy when the product first launched. Throughout 2025, we have an average of nearly 300 new patients on medications each month. We also saw a significant growth in member engagement with this program. The engagement rate means that of those that we spoke to on the phone, 93% of those members opted into the new to therapy program. In other new to therapy programs that we run through Genoa Clinical Services, we typically see the engagement rate somewhere between 80 and 85%. So the fact that the engagement rate is over 90% with Cobenfy showed us that members are likely more willing to speak to a pharmacist about their new medication, especially when it's a new product to market. When comparing persistency of members that are part of the new to therapy program to those that are not part of the program, we noticed that these members in program have overall a 12% higher persistency rate as compared to those that are not enrolled in the new to therapy program. Displayed here are some market insights. First to note, we at Genoa have a very broad dispensing footprint. Genoa operates in 47 states plus DC, ensuring nationwide access and scalability for Cobenfy prescriptions. Additionally, 70% of Genoa pharmacies have dispensed Cobenfy in 2025. This extensive reach supports prescriber confidence in consistent medication availability. Our top dispensing states include Indiana, New York, Ohio, Michigan, and Arizona. These regions represent strong adoption trends and opportunities for targeted prescriber engagement. Our strong conversion rate of 78% from prescription to dispense demonstrates effective operational processes and patient onboarding. This metric reflects Genoa's ability to overcome common barriers like prior authorizations and patient cancellations. Finally, we exhibit efficient turnaround time. Our average turnaround time for Cobenfy dispense is 4.6 days, which is critical for timely initiation of therapy. Faster dispensing reduces delays in treatment and improves both adherence and patient outcomes. Shown here is a payer overview. You can see from this graph that our largest payer presence is split between Medicare Part D, Standard Medicaid, and Managed Medicaid programs. Since our Genoa pharmacies are embedded primarily within community mental health centers, this is the breakdown that we would expect within our population of patients. I always enjoy highlighting a positive patient impact story to show the value of pharmacist intervention, especially in new to therapy programs. In this scenario, a patient reported taking Cobenfy 1 hour before and 2 hours after breakfast, rather than dosing throughout the day as indicated on an empty stomach. The pharmacist recognized the misunderstanding of instructions and counseled the patient on appropriate dosing of the medication, including timing of doses and to separate Cobenfy from food. These enhancements promote both safe and effective medication use. The pharmacist recommended taking 1 capsule in the morning and 1 capsule in the evening without food for enhanced benefit. During the next scheduled check-in, the patient reported taking the medication as the pharmacist recommended on an empty stomach. As a result, the patient reported feeling more clear-headed, as well as reported an improvement in her dry mouth symptom. These types of interventions can help to encourage patients to continue therapy on medication. Next, we will review operational challenges and opportunities to overcome these challenges. As with many new brand name products, prior authorizations are a common challenge. There are differing requirements across third-party plans, which places administrative burden on pharmacy and prescriber teams to obtain prior authorization approval. This can result in delays in therapy initiation and continuity when prior authorizations expire or when members change insurance plans. To help make this process easier, Genoa can help identify general requirements for prior authorization approval to help streamline this process. The following slide will show some tips and tricks on how to help move prior authorizations through. Here are some general rules of thumb to help get those prior authorizations across the finish line for Cobenfy. The first step is to confirm the diagnosis and ensure that schizophrenia is well documented in the clinical notes. The next step is to provide documentation of treatment history. Sometimes evidence of inadequate response or intolerance to 2 or more antipsychotics is required for Cobenfy approval. The next step is to provide clinical justification. So this would include explaining why Cobenfy is appropriate for the patient, such as highlighting its unique mechanism of action or perhaps its reported efficacy and safety profiles. The next step is to make sure to include the prescriber details. Oftentimes, licensed prescriber information and specialty are helpful to help to move the prior authorizations through the process. And finally, attach any monitoring plans and supporting documentation that you may have. Outlining the adherence and adverse event monitoring strategy could be helpful. It can also be helpful to submit the PANSS score or any other clinical assessments that are relevant to the disease state and the treatment plan. You may also consider attaching any recent progress notes that support the need for Cobenfy therapy. Genoa can help streamline the prior authorization process by helping to gather this required clinical information. We can also coordinate with prescribers and payers, which can reduce delays that impact patient adherence and treatment continuity. I encourage you to utilize your Genoa pharmacy teams to help assist you along in this process. Finally, here are some closing remarks and final takeaways from today's presentation. In summary, Cobenfy has a unique mechanism of action. It combines xanolamine, which is the central muscarinic agonist, and trospium chloride, which is the peripheral muscarinic antagonist. In combination, these make a novel approach to schizophrenia treatment that are distinct from your traditional dopamine and serotonin blockers. The Emergent-4 trial showed that nearly 70% of patients achieved a 30% or more PANSS reduction with comparable efficacy to leading antipsychotics and lower weight gain versus risperidone and olanzapine. Common adverse effects include GI symptoms, hypertension, and dizziness. Contraindications include urinary retention and untreated narrow angle glaucoma. Cobenfy is dosed twice daily on an empty stomach. Titration to maintenance dose is critical to minimize GI side effects and ensure adequate trospium coverage. Our Genoa New to Therapy program provides structured support for patients starting on Cobenfy, focusing on adherence, education, and adverse event management. We provide weekly calls in month 1, bi-weekly calls in month 2, and quarterly calls thereafter for 12 months. Using this approach, we've obtained high engagement rates, improved persistence on product, and reduced therapy gaps. By coordinating and integrating with providers, we are able to communicate drug therapy problems and work collaboratively to optimize patient outcomes. We've identified the main challenge of prescribing Cobenfy, which includes complex prior authorization requirements. Again, Genoa Pharmacy can offer prior authorization support, prescriber education, and data-driven performance monitoring to help mitigate these challenges. In closing, I want to highlight what it looks like to partner with Genoa and how our model supports both prescribers and patients throughout the treatment journey. First, Genoa operates through an integrated care model. That means we're not just dispensing medication, we're also embedded within care teams, providing real-time coordination and ongoing clinical support. This includes things like education series for providers, as well as deeper dives into specific medications like Cobenfy to ensure that teams feel confident prescribing and monitoring treatment. Another key area where Genoa partners with clinics is prior authorization support. Because we work with so many different payers and specialty medications, we understand the plan-specific requirements and can help to streamline the process for prescribers. That means gathering the right clinical documentation upfront, supporting submission, and helping reduce delays that can lead to gaps in treatment. Once the medication is approved and initiated, our team continues supporting adherence through clinical outreach, follow-up calls, and proactive monitoring. This is especially important for new to therapy patients starting medications like Cobenfy. Finally, Genoa pharmacies play a critical role in identifying and resolving drug therapy problems. During clinical calls and follow-ups, we screen for issues related to dosing, administration, side effects, drug interactions, and overall appropriateness of therapy. Anytime we identify a barrier or even a potential risk, we communicate directly with the prescriber to help resolve it. The goal is always the same: safe, effective, and continuous medication use. So when you partner with Genoa, you're getting integrated support across the entire medication journey, from access to clinical monitoring to resolving problems and improving outcomes. Thank you so much for tuning in to January's monthly educational series presentation. If you have any questions on today's presentation, feel free to reach out to me at my email address listed on the slide, sthompson3@genoahealthcare.com. Our February topic will be covering HIV, substance use disorder, hepatitis, and infectious disease presented by Genoa's subject matter experts. More to come on this in mid-February. As a reminder, you can find previous educational presentation recordings on our Genoa YouTube channel at www.genoahealthcare.com/center-partner-resources. Thank you so much for tuning in. Have a wonderful rest of your day.